Welcome back to continue our discussion talking about substance abuse. Joining me again is Eric Rolen, substance abuse counselor with Palmer Continuum of Care.
Yeah.
Let's jump in because in our first segment you told us quite well and gave us some exact things we should be doing in terms of talking to our children and how young and what to talk about and those types of things. Let's sort of focus on prescriptive drugs now.
Okay.
Now, as adults, of course, we may have many prescriptive drugs that we're taking, and we may not even think of those as being something that can be in harm's way. And there is a commercial that's out that talks about basically the drug dealer having difficulty getting clientele because everybody's using the parents' drugs.
Right.
Tell us about prescriptive drugs.
Well, that's a great commercial because it's funny because it's true, and I think that's why so many of us adults identify with that commercial. I work continually in the school systems here in Tulsa and around the Tulsa area, and I can tell you that unfortunately most school systems contain multiple prescription drugs that are being traded illegally.
On school grounds?
Yes.
Okay.
Yes, and they're getting those drugs from their parents, from their grandparents, from their siblings, oftentimes someone on disability who has to manage chronic pain, especially with the hard economic times. They may tend to start selling those prescriptions to make ends meet, and usually the recipient, the buyer of those medications are high school age children.
Now with the prescriptive drugs, are you seeing where kids are basically taking the bottle of pills and the parents wondering, I thought I had a bottle someplace, or are they basically extracting a few pills out where maybe the parent, you can't necessarily recognize that versus thinking, oh, I just ran out?
Generally it starts with, sneaking out a pill or two pills, and it's like anything else. Once someone, identifies, hey, I can get away with that, no one was the wiser, then it usually increases, and then you'll start to see they become addicted to that substance, or they become used to the money that they're making, and then they will start taking whole bottles. And that's usually when the parent notices and says, wow, I had a whole bottle of hydrocodone and I can't find it. And by that time, it's, the person is usually well addicted to the opiate.
So what should parents do with their prescriptive drugs? Because some parents may say, well, my children are totally trustworthy. They wouldn't bother anything like that. But what should we do and what should we think?
Well, I think treating prescription drugs like a drug, like we would alcohol, that we wouldn't just make it available, right on the shelf. Most adults keep alcohol locked up in a liquor cabinet if they choose to consume that recreationally. And so the same caution should be used with prescription drugs. Even if your child doesn't use the substance, it has a high value at school, and so they can seek acceptance into a peer group. They can use that to try and make money. It gives them leverage. It's really a currency in the school system.
And with school systems too, all of them may not do that, but I know within Tulsa Public Schools and other districts, you have the policy, medication policy, where prescriptive drugs have to be brought to school by the adult and delivered straight to that particular clinic facility. And then the child has to come in order to get the prescription based on what's been ordered. It's not where the child can keep it with them and carry it throughout the day. Unless there's something that's terribly medically indicated and the doctor concurs with that. Of course, those exceptions do exist. But on a routine basis, it's handled that way.
Absolutely. Tulsa Public School System has done an excellent job putting measures into place. And that's why today I want to speak to the parents and say, let's take care of this on both ends. Let's be careful with what we make available. And we know that when we send our kids to school that Tulsa Public has measures in place. But we have to be watching this on both sides.
Exactly. And wherever your child is in school, check with that district to find out what are their policies on medications. And if they don't have that, begin to talk to them seriously about considering that type of policy.
Absolutely. And above and beyond prescription drugs, Tulsa Public Schools has addressed the issue of abuse of over-the-counter medication.
The same way.
The same way, which is fantastic, because what we're seeing is, especially with the younger children, is that they will use a cough or decongestant medication. They will take that in excess, and it produces a high or a euphoria, an experience of altered state of consciousness.
Now that's another thing then swinging into those over-the-counters, because you're perfectly correct. In Tulsa Public, that policy applies to those medications as well. But you talked about cough medicines and things like that. Now let's say the parent in the home or whoever is responsible for that child. Should they lock up these? Because those are things that we don't really think about, when you're taking the decongestants and the antihistamines and all of those. We just have them usually in the cabinet.
Right. If it's a medication that can be abused, I would recommend monitoring how much of the medication is being used. Or if there's some question in that, then keep the medication locked up. Tracking how much medication is being used is really paramount. One, it gives the parent peace of mind that they don't have to worry, and two, if anything does arise, you can track that and measure that. So if you have a prescription bottle, writing down the number of pills on the outside, or if you have an over-the-counter medication, they usually come in blister packs, so you count the number of blister packs in the box, and you're checking to see how many are punched out at a time.
Now, there are some of these over-the-counters that kids can buy from the store themselves without an adult.
Right.
So what are some of the signs that we would need to look for in our children to see if something like that's happening? Because we may not see it because they can go purchase it.
Right.
But what would we see? What kind of high does it give them? Do they act a lot differently? I mean, what would show?
Well, it's similar to consuming a large amount of alcohol. Slurred speech, trouble with coordination, trouble standing, dizziness. In excess, it causes nausea and convulsions, and the person usually will black out.
Okay. Do you see anything with the eyes being dilated? I mean, if you're talking to your child or more constricted, or are there any things like that you would notice?
Well, most of those medications are a stimulant. So, stimulants generally dilate the pupils, but not all of those medications are going to have that effect on the pupils. So it's really tough. It would be easier to tell by kind of a distant gaze. I mean, the lights are on, but nobody's home. I mean, they're kind of just off in their own world, not really connecting all the dots, not really being coherent.
Now, would use of, say, over-the-counter medications, we know how some of the prescriptive drugs can make you react, would it cause some decrease in school performance? I mean, if they're taking it at enough volume level, do they end up sort of disassociating with schoolwork as well, and so you may see some change in the grades, or they're wanting to engage in certain activities?
Well, and that's not drug specific. With all substance abuse, you generally have a pattern of what's called self-regulation, where the person begins to experiment. They identify that that's an experience that they want to repeat, and internally they know that it's not approved of by society, so they carry on this facade that everything is fine. It takes a lot of energy and a lot of focus to do that, and what we see continually in addiction is that generally breaks down 6 months to a year, and things start to really fall apart in their life, and that's when the grades start to go, the relationships start to crumble, there is an increase in deception, and by that time, the substance abuse problem is really, out of control.
Now, should we, before we go to a really quick break, should we sort of inspect our children's rooms and kind of look for things?
Well, I think if we're involved in their life, if you're doing laundry, you're in the closet, if one of the rules is for the child to have his room clean, you can go in and do an inspection. And if there is a cause for alarm, you simply come to your child and you invite them to search the room with you. You explain the reason for concern, and you explain to them that you're going to do a search, and then you invite them to join you, so that they're not going to be happy about that, but at least you're including them in the process.
Okay, we're going to take another really quick break and come back and talk about some of the other heavy-duty drugs.
Okay.
Please stay with us. We'll be right back.